Professor Huang, please.
Again, I would like to thank Liz and Randy for the invitation. It's good to be here in the CFI new building in Washington, D.C. I'm going to talk about the future of China's public health. I noticed that on the eve of the 60th anniversary of the founding of the PRC, the Minister of Health released a report claiming that China's average life expectancy has increased from 35 years in 1949 to 73 in 2009. A 2007 report released by the influential Chinese Academy of Sciences predicted that China will jump, the China's average life expectancy will jump to 85 years by the middle of this century. So reasoning along this line, we could expect that by 2025, China's average life expectancy would be about the same level of the United States today, which is 77.9 2009. What the government report didn't say is that over the past 3 decades, reform of opening was only associated with 6 years of improvement in the average life expectancy. So 80% of the gains actually were achieved under Chiang Mai Mao. So if economic development does not trickle down, one wonders whether a great leap forward in people's health status is a plausible scenario. Indeed, if we take a look at China's disease burden, there seems to be few reasons to justify a healthy dose of optimism. As a result of epidemiological transition in China beginning in the 1980s, chronic diseases such as cancer and cardiovascular diseases are now the leading killers in China. I'll give you some numbers. Today, an estimated 177 million people, 13.6% of the population, have hypertension. For every 21 seconds, a Chinese dies of stroke. The disease burden continues to increase given this rapidly aging society and the increasingly unhealthy diet habits or lifestyle among the Chinese people. In addition, the country is facing all kinds of infectious disease challenges, including HIV/AIDS, sexually transmitted diseases, tuberculosis, viral hepatitis, endemic schistosomiasis, and so on. Believe it or not, China accounts for 37 to 50% of the hepatitis B virus-related death worldwide. There's no denying that drawing lessons from the 2003 SARS, China has made considerable progress in strengthening the capacity of dealing with major public health challenges. That was evidenced in the recent H1N1 flu pandemic. The government, in sharp contrast to the initial response to the SARS outbreak, actually has become highly sensitive, responsive to public health emergencies. But a more in-depth analysis of the government capacities in this area reveals some intractable problems. I'm going to name a few. First, in responding to public health challenges, more attention, more resources are concentrated in those high-profile, sexy diseases such as HIV/AIDS, H1N1, rather than those equally, if not more dangerous diseases such as TB or chronic conditions. Second, central-local capacity gap remains a major challenge the Chinese leaders have to come to grips with in its capacity building. My study of China's response to H5N1, H1N1 suggested that the problems of cover-up, misinformation, inaction continue to characterize the local response to infectious disease outbreaks. And last but not least, despite the government acknowledgement of the role of civil society in disease prevention and control, as Minxin also pointed out, the government continues to suppress the growth of health-promoting NGOs or community-based organizations and continue to harass, prosecute, even persecute the NGO leaders and the rights-promoting lawyers. So as a result, China's health-promoting NGOs remains weak, small, and competition over limited resources led to infighting, conflicts among the organizations that only provide more excuse for government manipulation and suppression. While the disease burden continue to increase, the government has indeed, we have to admit that it has geared up its support for healthcare. We know a new wave of healthcare reform was launched in 2006, and actually by the end of 2008, the national health insurance coverage rate reached 86%. That is actually slightly higher than the US level. Believe it or not. Earlier this year, Beijing also promised to pump 850 billion yuan, that is about $139 billion into the healthcare system by 2011. The objectives is similar to, although not as ambitious as Obama's, that is to build a basic medical healthcare system by 2020 to provide, quote unquote, safe, effective, convenient, and affordable health services to everyone in China. So clearly, the government is playing an increasingly important role in the health sector. However, in view of the China's mammoth population, the per capita government spending on healthcare is still far from substantial. Since the central government only showed us 40% of the promised mass funding, whether the government financial support would be materialized still depends on the cooperation of local governments, which we know continue to make healthcare a back burner issue in its pursuit of GDP. And despite the growing coverage, the benefit level remains low. Actually, the so-called universal healthcare, in a sense, legitimized the huge urban-rural gap in healthcare access. For example, based on the government formula, an urban worker would eventually be reimbursed up to $26,000 US, compared to only $4,200 for a farmer. Last year, a young farmer in Beijing with severe anemia conducted a robbery and was happy to be sentenced 18 years in prison. The intention? To stay in jail long enough to enjoy free medical care which he could not afford. It is also worth noting a major portion of the government funding is being used to strengthening grassroots health institutions, but no effective rules or regulations are in place to prevent it from being misused or abused by corrupt government officials or health providers. So in that sense, China faces similar challenges similar to the United States in healthcare administration. That is, how to expand the coverage while at the same time improve significantly the efficiency in delivery healthcare. So I realize my time is up, so I will quickly summarize. There has been growing government attention on and commitment to the public health since 2003. And that reflects an ongoing national agenda shift toward so-called scientific development in order to create a so-called harmonious society. Indeed, impressive gains have been achieved in this area, but many of the major public health challenges cannot be effectively addressed with only increased government funding or policy support. To significantly improve Chinese health status in the next decade or two, the government will have to make more fundamental changes in public financing, in state-society relations, and in bureaucratic incentive structure. So I'll stop here.
Thank you. Thank you very much, Professor Huang. Kelly Curry.
Thank you. I guess I'm going to follow up on some of the themes that Min-Shen started out with, talking about the stable macro situation versus the unstable micro situation when you think about ethnic minorities in China. The recent events in China over the past 2 years in Tibet and Xinjiang have been a rude reminder to most Chinese that they do in fact live in a multi-ethnic society. In talking about ethnic communities in China, I have to make some caveats to begin. The Chinese talk about 56 ethnic nationalities in China. I'm going to